It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my loved one has HIV, lymphoma in his brain, seizures, is septic and is ventilated. The intensive care team is trying to take my hope away and they're all negative. Help. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question that our readers ask quite frequently, and the question this week is: what are the risks and benefits of a tracheostomy? If your loved one is critically ill in intensive care, and if your loved one has been ventilated via an endotracheal tube or a standard breathing tube, and if your loved one also hasn't been able to get off the ventilator, and if they haven't been able to be weaned off the ventilator, the intensive care team may have mentioned that they are thinking about performing a tracheostomy. A tracheostomy tube is a tube that is inserted in a patient's neck into the windpipe or trachea. It's a substitute for the breathing tube or endotracheal tube if a critically ill patient can't be weaned off a breathing tube on a ventilator. There are numerous reasons why a critically ill patient can't be weaned off a ventilator and may need a tracheostomy, and we have addressed most of the issues in related articles that you can check out below this video. There are links to articles and videos, so check these ones out. It starts with: why does my loved one need a tracheostomy in intensive care? The other article that you can check out is: how long should a patient be on a ventilator before having a tracheostomy? The next article you can check out is: why doctors in intensive care insert a tracheostomy after an induced coma? And also, how long can a breathing tube or an endotracheal tube stay in? In today's video, we only want to focus on the risks and the benefits of a tracheostomy, so let's dive right into it. Let's look at the benefits first. A tracheostomy tube is, generally speaking, a lot easier to tolerate for a critically ill patient in need of ventilation, as opposed to a breathing tube or an endotracheal tube through the mouth. In essence, a tracheostomy tube is a breathing tube as well. However, it's in a different location that is much easier to tolerate for a critically ill patient. As soon as a tracheostomy has been performed, sedation and opiates or pain medication can be reduced or even taken away to a bare minimum, and a critically ill patient can either be woken up, or it can be attempted to wake a critically ill patient if they are otherwise medically stable. In any case, by now you would have seen that a breathing tube or an endotracheal tube through the mouth is very uncomfortable and requires a fair amount of sedation and pain medication to keep your critically ill loved one comfortable. As soon as the tracheostomy has been performed, the weaning process of a ventilator can be commenced if the clinical condition allows. That means as soon as sedation is either reduced or taken away completely and a critically ill patient is more awake, trials to take away the ventilator for periods of time can be commenced. This would be very difficult to be achieved without the tracheostomy, because critically ill patients with a breathing tube or an endotracheal tube require sedatives and opiates or pain medication that keep them in an induced coma. The tracheostomy tube tends to be a good conduit to get patients off sedatives, off opiates, which is the pain medication, and get them out of the induced coma quicker, and then start the weaning process off the ventilator. Also, the management of suctioning and the management of secretions tends to be easier as well due to a tracheostomy having a short length compared to a breathing tube or an endotracheal tube who is much longer, and therefore suctioning and secretion management tends to be far more difficult and also tends to be far more uncomfortable. It's also easier for a critically ill patient to cough up their own secretions due to having less sedatives in their body system, and also due to the tracheostomy tube being shorter compared to a breathing tube or an endotracheal tube. Next, once a critically ill patient is more stable on the tracheostomy and has had time off the ventilator as well, the next steps can be to use a speaking valve so that they can start talking again. Overall, communication with the tracheostomy tends to be much improved compared to patients with an endotracheal tube or a breathing tube. This is because of less sedation, less opiates, and also because the mouth is not being obstructed by a breathing tube any longer. Even if patients can't talk as yet with the speaking valve, they can now use a letterboard or can write if they are stable and are not confused or in a coma that's not related to sedatives and opiates, which is the pain medication. Next, if all goes well and your critically ill loved one can be off the ventilator completely, it also should allow for a discharge to a ward area even with the tracheostomy. Also, a tracheostomy allows for improved mouth and oral hygiene. Teeth can be brushed, and even though oral food or fluid intake is often restricted with the tracheostomy, small steps towards eating and drinking can be taken by using crushed ice or sips of water. And even though food intake is generally speaking not allowed with the tracheostomy, again, small portions of food or a thickened diet can be used and lead to more oral food intake even with the tracheostomy. Now, let's now look at the risks of a tracheostomy. The major risks of a tracheostomy are that it's an invasive procedure and it requires a cut in the skin. Also, it's a foreign body in a critically ill patient's windpipe or trachea. Also, a tracheostomy needs specialized staff, doctors and critical care trained nurses to look after. Next, it has an increased infection risk due to the invasive procedure and also due to the bypass of the normal infection prevention structures such as the nose and the mouth. Next, a tracheostomy may weaken the trachea or the windpipe. Another risk is that a tracheostomy may block easily and therefore needs constant monitoring. Also, a tracheostomy is a barrier to communication compared to living without one. It's improving communication when comparing with a breathing tube or an endotracheal tube through the mouth. Next, a tracheostomy may lead to more ventilation support if the weaning of the ventilator fails. Keep in mind that the initial tracheostomy is often done to speed up the weaning process. Therefore, if weaning fails, critically ill patients can often enter a vicious cycle where they get depressed. Depression, lack of quality of life, in combination with ventilator dependency and a long-term stay in intensive care, can sometimes aggravate the situation, and the depression triggers the ventilator dependency, and the ventilator dependency triggers the depression. I really hope that helps, and I hope that clarifies how you can weigh up risks and benefits if your critically ill loved one is ventilated in intensive care and may need a tracheostomy. Please let me know if you have any questions. Send your questions to support@intensivecarehotline.com. How can you have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care. You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight so that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download for your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free Instant Impact Report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.